A nurse's role is not just limited to the bedside. There is a vast need for the involvement of nurse administrators in discharge education, research, and the implementation of practices. In a study performed by Naylor and Macaulay, it was determined that the clinical expertise of a master's prepared nurses can have a positive impact on the transitions of complex cardiac patients. Masters prepared nurses can ensure that evidence based practice guidelines are embraced and implemented into practice consistently and correctly. According to the American Organization of Nurse Executives, core competencies that a nurse executive must obtain have been identified as communication and relationship management, knowledge of healthcare management, leadership, professionalism, and business skills. These skills will allow nurse administrators to be successful. Each core competency listed plays a vital role in the implementation of a standardized approach used for cardiac patients' decision to admit and discharge. Communication and relationship management is a critical element to the success of a planned change, such as this one. If change is not communicated, a threat to team morale, productivity, and patient outcomes can arise. A nurse administrator must be transparent, clear, and available to answer questions as appropriate. The nurse administrator must have effective communication during meetings, presentations, and collaborations in relation to the planned change. In this case, involvement of multidisciplinary teams allowing for discussions and feedback on a standardized guideline used at discharge can offer insights that the nurse administrator may not have been aware of. Effective communication builds healthy relationships among the team and thus increases efficiency, safety, and employee satisfaction. Knowledge of healthcare management is essential for the nurse administrator. Awareness of current practice guidelines as well as departmental needs and abilities can make or break the implementation of a planned change. In addition, they must understand limitations and regulations and must ensure that the proposed intervention would adhere to state and federal standards. For example, if the nurse administrator is not able to identify the major limitations of patient portals as it relates to patient privacy standards, then its implementation may not be a viable addition to the proposed intervention. Also, when assessing patient portals for ease of use, nurse administrators must take into consideration user friendliness, design, and availability on the availability of portals on different platforms, which may create issues with compliance. Leadership and professionalism are qualities a leader must possess so that team members can trust, respect, and buy into change. According to Helm, Stevens, Kipley, and Jew, the leaders can have influence on actions and behaviors of the team. Therefore, they must act with dignity and respect. Acting as a role model while treating others honestly and with respect will earn leaders' trust. Leaders must also be ethically sound and uphold the core values and principles of the organization. Nurse administrators must be accountable and hold the team accountable for expectations and outcomes. They must involve team members and motivate them through mentorship and guidance by being a positive force for proposed change. Lastly, having business skills as a nurse administrator is an expertise that is vitally important to the implementation and longevity of a proposed change. By having the ability to assess short and long-term effects related to financial, human resource, strategic, and information and technology management, a proposed change can be implemented smoothly. For instance, if more bedside nurses are needed to serve as transitions coaches to safeguard that discharge guidelines are consistently done effectively, a nurse administrator would need to assess non-clinician expenditures for the year, the projections for the following year, and if possible, work with human resources to begin the recruitment process. While nurse administrators are vital to the evolution of change in practice, we must not forget to take note of the monumental importance of the bedside nurse. Bedside nurses are the key staples that carry out planned change. As per Coleman, the role of the bedside nurse is to act as a transitions coach, especially during times of increased vulnerability, and their role is vital to the patient's overall outcome. The nurse must ensure that upon discharge, the patient is knowledgeable about their medications, has the ability to manage their personal health record, attends follow-up visits, and is knowledgeable about the symptoms that might worsen their health state and how to respond accordingly. Patients and family need guidance during a time that is very frightening, and nurses can help ease their transition from hospital to home. Having a nurse that is both supportive and knowledgeable can benefit these patients in so many ways.